Thanks very much, everyone. It's great to have the opportunity to speak to you about éclateral and the low-cost diagnostic platform that we've developed. The pandemic taught us two things. The first is that healthcare systems are vulnerable. In the UK, the NHS is certainly still struggling to recover from the backlog of appointments caused by the pandemic. The second thing that it taught us is that patients can be trusted to take tests at home, something which wasn't widely being done before outside of diabetes. There are now multiple drivers to keep patients out of hospitals, to keep costs down, and not just keeping them out of hospitals, but getting them, once they're in hospital, back home as early as possible. The technology that we've developed is essentially a lateral flow test that becomes completely digital by making it electrical as a readout rather than visual. The test itself still looks like a lateral flow test, but it's powered by a pocket-sized, very low-cost reader that connects to the mobile phone to show the result and push results from patients' home into their electronic health records and for visualization by a doctor. An example of the kind of application that this technology lends itself to is the testing of C-reactive protein, which is probably the most widely tested protein in medicine. It's very widely tested because it can be used to indicate anything from early warning of a heart attack with a high sensitivity CRP test and levels between 1 and 5 milligrams per mil in blood, all the way up to warnings of sepsis with a 10,000-fold increase in the levels of that protein in blood. It's also used for monitoring patients with rheumatoid arthritis and other inflammatory conditions at levels between 0 and 20. It's a very standard hospital test. It's the box that almost every doctor ticks almost every time that they have a diagnostic chart in front of them. It's standard in hospitals. It's very low cost. It's on all of the hospital analyzers, but its uptake at point of care has been very slow, even though it has just as much potential utility there. Our focus on CRP testing is driven by the global crisis of antimicrobial resistance, which is the second biggest threat to humanity after climate change. By 2050, so in 26 years' time, more people will potentially be dying of an antibiotic-resistant death than dying of cancer. And tens of thousands of people in Europe are already dying because they can't be given the right antibiotic at the right time. In the UK, 35 million prescriptions for antibiotics are written every year, most of those by GPs, mostly for respiratory tract infections. There are 3 tests that have been approved for almost 10 years now for guiding the prescription of antibiotics in the UK. None of them have been widely used, and that's because the costs of the readers are too high, in the thousands of pounds. Our test, the reader costs, this pocket-sized reader that I just showed you, costs us less than £20, 20 euros to make, and the cost per test is £2. So this is a very low-cost test that should be accessible. But even at those low costs, there's potential sales in the UK alone of £56 million a year if we follow the example of the Netherlands, for example, and make sure that every antibiotic prescription is preceded by a test for CRP. I've already alluded to the fact that CRP is tested beyond infection, and tests for patients with rheumatoid arthritis, for example, can have monthly tests for CRP, which helps them to manage their self-use, self-medication with steroids. A CRP test that they could take at home would prevent those people with poor mobility and pain from having to travel to hospital. And again, there's clinical pathways already in existence in the UK, but no at-home test that people can use. When we've spoken to patients and to doctors and to providers about how our CRP test might change lives, the feedback is uniformly positive. The way that we're going to roll out our CRP test is through care homes rather than through the NHS in the UK. The reason for that is that in the UK, care homes are private companies that are competing for both clients, patients, and for contracts on the basis of quality and cost. So our low-cost test sits right in what they need. They're under regulatory pressure to show that they're using medicines, and particularly antibiotics, correctly, and they're solving an elderly population that is particularly vulnerable to infection. And you can imagine that an antibiotic-resistant infection in a care home could be absolutely devastating. So reducing antibiotic use and reducing the risk of antibiotic resistance emerging in that care home is something that they're very interested in. A lot of feedback from customers about how they might use this, particularly in COPD, which is the responsible for 6% of emergency hospital admissions to hospital. Patients not being able to manage COPD correctly in their own home. They're given emergency packs of antibiotics, but they don't know when to open them when their symptoms are getting worse. With an at-home CRP test, that would change. So there's roughly how our system compares to the lateral flow test technology that inspired it. You remember taking lateral flow tests during the pandemic, trying to guess whether or not there was a line, trying to decide whether you were going to report the test, which had to use a separate app. By making the measurement electrical rather than visual, the test becomes completely objective. You're no longer guessing whether or not there's a line, but you can also measure how strong that line is. So the test really becomes something that people can be confident in. Because it's a digital test, it's data secure. Every test taken can be reported as required. We have 2 patents already applied for on the whole system, but the system is really simple. And when you're interfacing biology with electronics, it's really important that you keep the system as simple as you possibly can. We're building on tried and tested technologies. So home monitoring for glucose is something that diabetics have been doing for years with a simple finger prick test. We've just built out the same technology, married it to the lateral flow test to deliver what we have. The test result is shown on a bespoke app on the user's smartphone. That's a result that could be shown to the patient if appropriate, but also monitored by the GP. And the GP remains the gatekeeper for the test and the outcome. We've developed 3 tests to date. A COVID test that was CE marked but not placed on the market because government stopped paying for tests just as we were ready. We've developed a pregnancy test, which is suitable for use by blind women who at the moment have no option of taking their own pregnancy tests, which is pretty devastating for them, and the CRP test that I've already mentioned. I want to highlight in our team that we have 2 people who between them have taken more than 20 tests to market already. Those are Jane Ellis and Marsha McNichol, who broke their teeth at wellbeing and Clear Blue. Jane was the head of women's health at Clear Blue, and that's relevant to our second test for the perimenopause. Marsha McNichol, likewise, LumioDX and earlier, so more than 20 tests taken to market. We are closing a £3 million fundraise at the end of this year, and that money will be used to take 2 tests to market, the CRP test that I've already mentioned, and a test for the perimenopause. That test for the perimenopause will be a multiplex test. We can put up to 12 analytes in a single cassette without a great increase in the costs. And that means that we can measure 4 sexual health hormones, 4 markers of diet, and 4 markers of thyroid function to be able to tell a woman in her 40s whether the symptoms she's experiencing are those of the menopause or whether something else might be going on. That same test would also be useful as a fertility test. And because men have the same hormones as women, it's also a test that could be used for men who are tired all the time, as I was in my 40s. The revenues on the basis of the CRP test, and these are UK-only figures, show that there's strong potential for growth. And that is everything actually that I wanted to say. So thank you for your time.
Thank you very much. Thank you.